This week's guest is Dr. Jeanette Musset. She is a naturopathic physician and founder of Health Medical in Scottsdale, Arizona. Her team empowers individuals to elevate their health and wellness. In the world we live in today, many patients are tired of the quick fixes and seek a more natural approach to their health and a doctor that considers their medical and cultural background. This is important when we put alcohol to the side because now we're in a position where we get to understand what was caused by the alcohol and what we're left with. What's the root cause of what's still bothering us? Because now we can rule out alcohol usage. So I'm looking forward to our interview with Dr. Musset. Because we have a doctor on, we're going to do a medical disclaimer. And the information shared here today is for educational purposes only. Nothing said or mentioned here constitutes medical advice or establishes a doctor-patient relationship. Always ask your doctor before implementing any new healthcare regimen. Welcome, Dr. Musset. It's so nice to have you here today. I am excited to talk about all the knowledge that you possess about our bodies.
Oh, thank you so much for having me. Such a pleasure being here. Thank you for inviting me. I'm excited.
Good.
Yeah.
Well, I want to get started with the question, what is a naturopathic doctor?
Mm-hmm.
How does one become one? How did you get interested in this? If you could just explain to our viewers and listeners what that is, because I didn't know what it was before I met you.
Mm-hmm. Yeah. So naturopathic medicine is a form of medicine that blends in a little bit of conventional. So in terms of the 4 years of education, so we do study biology, we do dissection to see how the body functions, that we do pharmacology, so the basic is almost similar to the conventional doctors, but what we do differently is that we add things like acupuncture. We learn about like herbs and interactions with pharmaceuticals. We learn about hydrotherapy. We learn about homeopathy. So we learn about other tools that we can use with patients, because your body is just not, it's more complicated than that. So we need to be able to use different tools to help patients. So not just only, with the conventional doctors, is either surgery or maybe medications. But we realize that that's not, it just doesn't work. Some people might need help with the food that they eat. They might need help in terms of lifestyle changes, stress reduction, sleep, those kind of things. And that's where I see that we're just a little bit different. We just bring a little bit more tools and tailor to each patient, depending on what's going on.
Yeah. And my kind of experience with you share with me that many times, and this is my experience as well, the doctor is treating a symptom, but not always the source.
Mm-hmm.
And I'll just be clear with our listeners, like Dr. Musset is, I was and am a patient of hers, to address in a very natural way some concerns I had about energy and, and the regular doctors were not understanding, like, you're just getting old.
Yeah, and I hear that a lot, right? People feel like, oh, I'm in my 50s, everything should fall apart. But that's really not true. Your body's so strong. You just need to figure out what the message is it sending to you. The low energy. Is it lack of sleep? Is it because you're skipping meals? Is it because you're stressed? Is it because of thyroid issue? You know what I mean? So my goal is to dig a little bit deeper to find why. Like, why is that happening? What is your body trying to tell us? What is the message behind the symptoms that you're presenting with?
And how do you do that? Like, how are you deciding or discovering what the root cause of a problem is?
Yeah, so that's a good question. So typically, all patients, we have to do comprehensive consultation. So I have specific questions that I ask, about sleep, about even at home, like socially, are you happy with, your spouse or kids and stuff like that? Stress level, what are you eating? Are you going to the bathroom? So they're like specific questions that we ask, and then other things will be tailored to you, like when, in terms of, let's say, like energy, have you tried maybe, I don't know, taking something maybe over the counter? Have you, are you tired like just by sitting down? Are you tired more in the morning? Are you tired like in the afternoon? Are you tired all the way, from morning at night? So it just tells me, depending on those little details, like exactly what's going on. So
I've
then,
never had a doctor ask me what time of day are you tired?
yeah. And then are you also tired even when you're like watching Netflix, like when you're not doing anything? So
When I first saw you, I remember I told you I woke up tired, and that really concerned me. We're going to get into the alcohol part of it
yeah.
in a little bit, but for me, putting the alcohol to the side, like I used to just think every symptom I had was because of alcohol. But when I got rid of the alcohol, then I could say, wait, I'm still having problems, but at
Yeah.
least it's not alcohol. What's
Yeah.
wrong?
Yeah. With like alcohol, it's actually gonna like almost like you don't have clear thinking about things. You know what I mean? So yes, it could definitely have been alcohol, but also like without because you had it all the time, it's just hard to know your normal. Like, what is your normal? Like,
Right. That was my problem. What is
yeah,
normal? So
yeah.
tell me about some of the things that your clients see you for. Like why would somebody go to a naturopathic doctor
Mm-hmm.
as opposed to a traditional doctor?
So, there are different reasons why people go to naturopathic doctors, but a lot of time they just want natural ways to treat their condition, right? Or they've tried everything and nothing has worked, and then they're like, oh, let me just see, like maybe this is my last stop, let me see if maybe you can figure out. So, and then also a lot of people like that we spend more time with patients. So like for my new patient consultation, it's 1 hour, so I really get to dig a little bit deeper. We have enough time to go over everything, and then there's a physical exam, and then I do run labs afterwards. So we have a lot of like information to really make a good decision on what's going on. But so in my case, people come to me for like hormonal issues. Let's say like low energy, weight gain, hair loss, menstrual cycle issues. They have PMS, night sweats, menopausal issues, low libido, those like really, or they can't sleep.
That
So
was me too. I was
yeah,
like,
or
and now I
sugar
sleep like a
cravings.
baby.
Sugar cravings, like things that like it's like I just don't feel good. And then every time I go see a doctor, they just want to give me, oh, maybe you're depressed, here's an antidepressant, but nobody's actually finding like, could it be like diet? Could it be my lifestyle? Could it be like a nutritional deficiency, like a vitamin deficiency? Yeah. So there are a lot of layers why people get sick, but typically most people, they just want a natural way to treat their symptoms. Their oral condition, and they've tried everything, and it's like, okay, let me see if maybe herbs can help.
And I want to just clarify because I heard a lot of kind of female things in there, but a male can go to to a
Oh,
a
yes.
naturopathic doctor
Oh,
too.
yes. Guys, mostly they come to me because of low testosterone. Like they feel like fatigue, no stamina, loss of muscle mass. They can't sleep, stressed. I see a lot of, especially like business owners, very stressed, and then weight gain too, So
Yeah, well, let's actually transition into that because since I've focused on my health and the non-drinking, choosing not to drink alcohol, I've studied a lot of the science behind my body, my
yeah,
brain, and my personal and physical suffering.
yeah,
And I knew for a long time that stress causes disease, but I don't think I believed it.
yeah,
I I used to think that stress motivated me to get things done, which is super frightening. And
yeah,
I didn't realize, like, when I was married, I
yeah,
used to be super because I was very stressed in that situation. And every time I got sick, I would literally go to the emergency room because of my lungs. And I'd
yeah,
need antibiotics, steroids, breathing treatments. It was horrendous. Like
yeah,
every single time I had nasal drip, not
yeah,
it would be a horrendous bronchial event. And I did not realize until after I got divorced and the stress was released.
mhm,
I didn't need that anymore.
yeah,
I Being sick was no fun, but I
yeah,
didn't need to go to the emergency room and
yeah,
think I was dying. And it wasn't until that moment that it really hit me like, this is true. This
yeah,
is true.
yeah.
And so I've studied that more. And I've read things like 95% of doctor's visits could be avoided
Mhm.
by reducing stress. And
Yeah.
I'm like, wow, over 90% of cancers could be avoided by this is like serious. So can we I know that you paid a lot of attention in your practice to stress and mindfulness and inflammation of the body. Do you want to talk about all the things that you look at when you get a new client related to inflammation and stress?
Yeah. So you just mentioned like something very, that's just such a good point. And that's part of the consultation, right? Like sometimes people come in and they have let's say that they describe their symptoms as, I don't know, I can't sleep or I'm fatigued and stuff like that. But once you really get a little bit deeper, you actually find that it could be like something like, let's say at home, right? Maybe they have like maybe their marriage is not going well. It could be like something that's that presents as physical, but it's really like a social thing. So that's why like it's good to know what we're dealing with, because let's say like somebody has stress and they end up with high blood pressure. So they go to the doctors, they check their blood pressure. Oh, your blood pressure is high. Okay, we need to give you a medication. But nobody is asking like what type of, like, is it okay at home? You know what I mean? Like, what type of stress are you on? You know what I mean? Like almost 90% of patients who come to me with high blood pressure is stress. And some of them, it could be as simple as I don't like the way people drive. Like they get like so irritated when they're driving, you know.
Right.
That's something that we talk about in terms of lifestyle changes. Like how do you change your mindset so you're not irritated easily by things you can't really control? So when it comes to stress, I need to know where the stress is coming. Is it something that's not going well? Is it, those kind of things? And then in terms of lab work, I definitely look at like CRP is like a marker that we can see, for inflammation. there's not really, cortisol, I guess we can see like in terms of stress. And then there are other hormones too, you can kind of tell what's going on. And then also like your electrolytes, and stuff like that, your cholesterol, your liver, kidney function, so I can kind of see how the rest of the body is functioning. And then I can kind of tell, oh, is this like a medical issue, or is it more like a lifestyle issue?
And how do you help your client? I came in as a fairly stable, emotionally stable person because I had done a lot of work. As a matter of fact, I remember you doing my physical exam, and you're like, do you have regular massages or anything? Like, you're not holding any stress in your body.
Yeah.
And I'm like, no, that's my coaching. I practice this.
Yeah.
I don't have to live with stress anymore.
Yeah. And yeah, so that's good. Yeah, even with physical exam, I can kind of pick out some things. Even when I listen to your lungs, I can tell people who like do like meditation and stuff like that. So there are things also you can pick up when you do a physical exam as well, that gives you clues on what's going on. Yeah, so it's just a matter of like really, from the blood work, from the physical exam, and then from the story that's coming from the patient. Also, sometimes patients tell you one thing, but you can also see that there is a layer to it too. So it takes good, a good doctor, but also spending a little bit more time with the patient.
Well, this kind of transitions me right into alcohol, because I lied to my doctor, and I think most people do on a fairly regular basis, about how much alcohol they're consuming.
Mm-hmm.
If you see a patient, their markers, like, I'm sure you ask them how much alcohol they drink.
Yes.
But are there things in their blood work or anything that's happening that where you suspect maybe they drink more than what they're sharing with me?
Yeah, so the best way that I've found to ask about alcohol, typically if you ask somebody, do you drink alcohol? Some people are taken back. Oh, it's only 2. But asking like, when you drink, what type of drink do you usually drink? Obviously, a lot of people say 2, but then it's more than that. So it's just how you phrase it and how you make it comfortable for them to share with you. So then in terms of lab work, I can tell by liver enzymes. Some liver enzymes are sometimes elevated, but then I try to figure out if it's not something else, because there are some like infections that can make the liver enzymes go up. There are certain juices that people take with a bunch of herbs that can falsely elevate liver enzymes. So it's a lot of digging to make sure that you're not accusing the patient per se.
Oh, yeah, that would be super hard. I just wonder if there was some secret method. The fact is that when I went to kind of traditional doctors, and I used to really I lied about how much I drank. And I always worried about the blood test coming back on my liver and my kidneys, but I always was surprised that they didn't really show a big elevation, or, it's in a range. I don't know. Sometimes, holistic doctors are looking at a deeper range, different range.
Mm-hmm.
So I always passed with flying colors, but we don't want our doctors to go, you're lying to me.
Mm-hmm. Yeah, and that's a good point too. Yeah, so we naturopathic doctors and functional medicine, we actually have like optimal number that we look at. Just because it says it's okay on your lab panel, that doesn't mean it's good. Like we should give you A+, right? But we just try to help you get to A+ without judging you with you know what I mean? So yes, so you're right.
You're
Like,
looking at so chances are I was drinking quite a bit. I don't usually share what I drink only because if you drink less than me, then you're like, well, I'm not as bad as her. And if you drink
right.
more than me, then
Yeah,
it's
yeah,
like,
yeah, yeah.
she doesn't understand how bad I am. Right.
Yeah,
But it
yeah.
was a lot. And I would imagine if I had chosen a naturopathic doctor,
Mhm.
they would have looked at optimal levels, and I could
Yeah.
not have possibly been
Past.
at an
Yeah.
optimal level with my level of drinking. Uh,
Yeah.
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 But the good
So,
news is the liver heals, right? If we don't take it too far, the liver is really good at healing. Because I think my liver had an A+ when you
oh
examined.
yeah. Yeah, it's really, yeah, that's one of the organ that really, yeah, it can turn around quicker, which is good. So when people stop drinking, yeah, they can get better. Yes, it's going to take a little bit of time, but they can really reach optimal health eventually. So it's not like a death sentence where like, oh my gosh, like alcohol is, maybe it has ruined everything, you know what I mean? So yeah, so definitely
But
there
you
is,
can definitely get it to a point of no return, which is unfortunate. My analysis, I don't want to scare people, but I want to go into the realities. The
yeah,
National Institute of Health just said cirrhosis of the liver is expected to triple
yeah,
by the year 2030. That's only 7 years away.
yeah,
And that's due to alcohol abuse, by the way. That cirrhosis is
yeah,
due to alcohol abuse. And
yeah,
what I've studied is that your liver can kind of go boom, down, 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 and you don't really have a lot of symptoms. And so some people find out too late.
yeah,
I tell my clients, and I tell my clients, like, make sure you start with a test to make sure where you are so that you know where you were and where you went without alcohol, because having this awareness of how much your body loves being
yeah,
alcohol free is a
yeah,
good thing. Yeah.
yeah. No, yeah, you're right. Yeah. So yeah, it depends on how far you've gone, but if you're too far gone, then it's, I guess there are other options, but for most people, like, I just don't want them to give up just because
Mm.
they've been told like the liver enzymes are up. There's, oh my gosh, so many herbs that we use that help tremendously to bring to for liver support, and then to bring those liver enzymes down. And then also talking to somebody, not just giving them like, oh, take this or take glutathione or something like that, but also helping them with the mindset,
Mhm.
figuring out why are they drinking, why is that like their choice, like is it stress, is it like, is there like some emotional things going on that they're trying not to deal with, you
Many
know?
times, yes.
Yeah. Yeah.
Many
So,
times,
yeah.
yes.
So
And
it's
how
addressing all those things too.
and how does alcohol affect the body? Like, I know that your liver produces it as kind of a toxin, as a strange substance and entering your body. How can you as a doctor tell us about what happens when we consume alcohol?
Yeah. So alcohol, like I know, especially with hormones, I know like a lot of, especially women who drink a lot of alcohol, it actually increases estrogen, like way, way too high. So we might see some like breast cancers due to
Thank
alcohol.
you. I just found that out too in the last year. It increases 8 different types of cancers, esophageal, breast
Mhm.
cancer. Yeah, but I did not realize it was because of estrogen.
Yeah. So when women come to me and they have, let's say they have a history in the family with breast cancer, and if it's like, let's say if it's like sister, mom, like really close, I typically tell them not to do alcohol at all, like as a preventative, even though like maybe they've been checked and they don't have any genetic issues,
Marker.
towards, but so I tell them, like, for you, it's a no, so so alcohol is just, first, it makes you like tired, and then like most people who drink, like they don't really, all they do is drinking, so they're not eating, so there's nutritional deficiencies. Obviously, we talked about liver, the brain also, like,
Oh
it
yeah,
just
brain fog.
messes, brain fog, a lot of brain fog. It creates, inflammation in the stomach, you know what I mean? So there are a lot of like bad,
What is
when
happening?
people go over.
Right. Because we're not talking about safe level of drinking, although I've personally decided there is no safe level of drinking
Yeah,
for me. But
yeah,
certainly people can have one drink and let it go. That's probably not most of our listeners. They're drinking probably more than they want to and know they should. I'm laser focused, right, with the National Institute of Health and
yeah,
alcohol. And I
yeah,
think we're just coming around to a new age of, again, having a drink here or there is no big deal. And your body just goes, oh yeah, it shouldn't be there, and it processes it and it moves on.
mm-hmm.
But when we do it so, it's such a normal part of our life, it just reminds me of years back when I was younger, the cigarette commercials, oh, it
Yeah,
offers you, because I used to smoke cigarettes for the same reason, to relieve my stress,
yeah,
to be cool, to fit
yeah,
in. Cigarettes are all the same thing.
yeah,
And I just think with the stress and COVID, and people trying to manage their stress with the substance that the commercials say will
mm-hmm.
alleviate your stress and will allow you to socialize and have fun.
Yeah,
Just, I don't think that's what alcohol provides to our bodies.
yeah. It's just a temporary solution, I feel like,
Yeah,
but not really fixing what's missing
right.
emotionally, or maybe you're bored and you drink because that's just something to do, at the same time, like, not doing well for your body too, so
No. Yeah.
yeah, yeah.
Yeah. And I know you, I know you love to see a healthy operating body.
Yes, I empower people to reach, optimal health. So
Yeah, and you do. You talk about kind of the real things, the stress in our lives. What are we doing to compensate it? How are we eating? How are we feeding our body at the cellular level, to get the
mhm.
nutrients we need to feel our best, to sleep
Yeah,
best, to
yeah,
be our happiest. You know what I
mhm.
mean?
Yeah,
And that's what I love about the work you do, because that's what you're looking at, like the
yeah.
whole
Whole
body.
person, whole person. Yeah,
Yeah.
yeah.
As we wind down, I'm going to ask you to tell people where to find you, but anything I didn't address that you think maybe we should address for our listeners and viewers that may be concerned about their alcohol intake, and anything you'd like to share with them before we.
So I just want to tell people, like, just don't give up just because you maybe started drinking and then it became a little bit too much and you can't control it. There are like ways that you can get help, so just encourage them not to give up and to seek care too. Not all the doctors are judgmental, so
That's such a good point. And one, I love the don't give up, because
mm,
when it comes to alcohol or any substance or any habit, you kind of got to go at it a couple of times,
yeah,
maybe even more at a couple of times to succeed. But it's an awareness thing. And I also love the fact that you said not all doctors are judgmental. They are loving and caring and understanding. One of
yeah.
the reasons I started not telling the truth to my doctor was when I was super young, like 26.
Mhm.
They asked me, like, how much do you drink? And I just told them the truth. And I forget what it was.
Yeah.
because I was a young kid, right? And I was going out and I was partying Friday, Saturday, Monday night. I'm sure it was 12 to 15 a week. And she went, "What? Like, that's not a safe level. And you need to be under 10." Like, I was like, "Really?" And I just, thought I was normal drinking.
Yeah.
And so from that point on, I never told the truth about how I drank, but I didn't even consider that
Hmm.
that was an experience from, I don't know. I suppose it was a concerned doctor, but it didn't elicit the type of reaction in me that, if she had addressed it like, "Wow, Roseanne, I don't know if you know this, but she was like, what?"
Hmm.
I was like,
Yeah.
"Oh."
Yeah, it can make people not open up the way you ask questions or the way you make them feel. But I just want your listeners to know that there is help out there. There are a lot of caring doctors and providers that can really help them. And then in terms of naturopathic medicine, obviously we're gonna help them with the mental side of things, the social, the lifestyle
Well,
changes.
and understanding, like with you, it was more understanding how what I put into my body or what I do with my body is affecting me. And so that's very consistent with what I do too, is just developing this awareness
Mm-hmm.
of how your body operates with alcohol and without alcohol so that you're motivated,
Yeah.
kind of stay the course, see the health, see that you mentioned blood pressure. Well, my
Mm.
blood pressure got to very dangerous, like you need medication levels. But because I was lying about my drinking,
Yeah.
but it was 100% drinking related. Because when I quit over 3 months and I just started walking, my
Mhm.
blood pressure went from like 150 over 93 to 120 over 76 or
Yeah.
something like that. So
Big
it was,
difference.
yeah,
Yeah.
yeah.
Mm-hmm.
So if somebody, is it telepathic
Oh,
medicine?
telehealth and
Oh,
telemedicine.
yeah,
Yes. So I'm licensed in Arizona, but I can see people from, other states.
good.
Um, and then we go from there. But
Well, if somebody's interested in finding you, can you let us know how they would find you?
sure. So my Instagram is Dr. Wellness Scottsdale. So it's DR Wellness Scottsdale. And then also our phone number is 480-608-4808. And
Awesome.
our website is drwellnessscottsdale.com.
Oh, perfect.
Yeah.
All right, Dr. Musset, thank you so much for being
Thank
on
you.
and just sharing with us all these wonderful tidbits of information about how, yeah, homeopathic doctors work and heal us, because you've definitely healed me in so many ways. And I just wanted to share that with other people. So thanks for
Thank you
gifting
for
us
having
with
me.
your
Yeah.
knowledge and expertise.
Thank you. Thank you for having me. Take care.